today could potentially be triggering for some people. So just to keep yourself safe, you can take a break if you need to, or speak to a friend or colleague if you need further support, or step out of the presentation if you need to do that too. But we're not going to be going into any explicit detail about any safeguarding. So please don't worry too much. Just to say as well, so there will be varying levels of knowledge and expertise in the room with us this morning. This is more of a general kind of refresh on safeguarding, what that looks in terms of reporting it to the OPCC, and what your responsibilities are. So for those of you that do have kind of that extensive knowledge, just see it as a refresh as well, because we'll be going through some of the new legislation that has come out too, which hopefully you might find quite helpful. I'm going to pass to Florence.
Brilliant, thank you, Liz. So just as a bit of an introduction of what our learning outcomes are for today, we're going to do a bit of an introduction into safeguarding children and young people. So looking at definitions, what is our responsibility as practitioners under law, and looking at statutory guidance, an introduction to the different types of abuse, and an introduction on how we can respond to disclosures or instances of child abuse. And then a little bit of a reflective activity to put this learning into practice. And then we move on to an introduction to safeguarding adults. So this is looking at the safeguarding principles, again, looking at definitions, our responsibilities and legislation. And you can see there's themes here, looking at actually how do we recognise and respond to harm and concerns, and looking a little bit more in depth at trauma-informed approaches to safeguarding, and again looking at our roles, responsibilities and reporting. So you can see there's a nice natural kind of split to the training today. The first half, part one, we are going to predominantly look at safeguarding children, and then we will move into safeguarding adults. What is really important with both of these is that when we are working with children and young people, we are also working with the families around them. So we will be working with adults as well. So if you do predominantly work with children, please don't leave us at the end of part one, because part two will also be relevant and interesting for you. And equally, if you work with adults, you might be working with parents or caregivers. So understanding children's safeguarding will also be important. So please don't switch off for part one. Thank you. So we are starting with safeguarding children and young people, and we're going to start with actually what is safeguarding. So whatever our role is, it is crucial that we understand what safeguarding means and what our responsibilities are, especially within our organisations where we are working directly with children and young people, or managing services that are working directly with the community. So safeguarding is recognising and protecting children from abuse and maltreatment, and it's about promoting the welfare of children to keep them free from harm. And there is a lot of legislation that kind of governs our practice and puts responsibilities on us to report concerns and to ensure that children are safeguarded from harm. There's a long list on the slide, as you can see, and I'm not going to go into detail about what each of them are, but give you kind of a little bit of a headline of kind of the overarching theme of that legislation. So we start with the Children Act 1989 and 2004, and this establishes that a child's welfare is paramount and sets out the duties for local authorities to protect children at risk. We then have the Children Act 2004, which strengthens the multi-agency working and creates clearer accountability to improve child safeguarding following the public inquiry into the death of Victoria Colombier. And we also have the Children and Young Persons Act from 2006, which aims to improve outcomes for children in care by enhancing local authority duties and promoting better support and stability. We then have the Children and Families Act from 2014, which introduced reforms around adoption, special educational needs provision and family justice to ensure children receive timely, coordinated support that meets their individual needs. And then we have the Children and Social Work Act from 2017, which again strengthens safeguarding practice, improves support for care leavers and establishes the new local safeguarding partnerships. And then this year, 2026, we've had the update to Working Together to Safeguard Children, which again provides that statutory guidance and also reinforces that multi-agency working. And on the next slide, we'll go into that in a little bit more depth. And then underpinning all of our practice is the United Nations Conventions of the Rights of the Child from 1989. And this sets out the universal rights of children around protection, around participation, around access to education, and it's around safeguarding their well-being and development. So if you would like to learn more about this, use this as a little bit of a touch point and a start point, as most of these kind of do overlap and really help inform our practice. But in terms of the updated Working Together to Safeguard Children, it was published in 2026 and it has 5 chapters in it. On this slide, we are just kind of highlighting what some of the changes are. Please do have a look at the reforms. There are also some great videos and also kind of grey literature, which are kind of talking pieces around what the changes are and what that looks like. But for chapter 1 of Working Together to Safeguard Children, it highlights how positive outcomes for children depend on strong multi-agency working and good relationships between professionals and families. This chapter adds information on the importance of agencies actively seeking to address discrimination and inequality experienced by families. So that's the really big change here, is we've got to actively challenge discrimination, as well as the need for leaders to create inclusive and anti-discriminatory cultures. So something there around just learning a little bit more around intersectionality and how we can challenge discrimination. And then for chapter 2, the changes are focusing on multi-agency safeguarding arrangements. It clarifies that collaborative leadership and timely decision making are needed for effective multi-agency working and addressing systemic issues. It strengthens accountability through a number of mechanisms, including reforms to inspections, independent scrutiny, and safeguarding partner reporting. And then accountability through the OPCC will be done through the quarterly reporting of safeguarding notifications to children's social care. And we will pop towards the end, I'll pop a link into the chat which provides advice for local areas on actually how can they embed working together guidance and also that new national framework for children's social care as well. We've got more reforms that have happened as well, especially in the SEND sector, so the special educational needs and disabilities. So the current SEND system has faced rising demand, long delays and inconsistent support across local authorities and across services in general. So the proposed reforms aim to address these challenges by reshaping how support is delivered from early years through to age 25. There is a timeline for implementing these changes, and some of them have the deadline of 2029 and some changes are expected to happen up until 2035. So these are slow and steady. We picked out some of the bigger changes to the SEND reform. So again, please use this as a starting point and go out and do some reading as well. But there is going to be a new national SEND system, which proposes a more standardised national approach to special educational needs and support so that children receive similar levels of help regardless of where they live. And this includes shared accountability across local partners such as schools, councils, health services and voluntary services. The second biggest change is around earlier and more accessible support. So looking at that early intervention and getting help to children sooner within mainstream settings to prevent needs from escalating, and schools will be encouraged and funded to provide support without requiring those formal plans or for less complex needs. And then this is the reform that will be happening up until 2035, but reforming education healthcare plans. The changes are going to see less formalised support for children and young people in the form of individual support plans, which can be directly implemented within schools. in the aim that it will be quicker and more flexible alternative to EHCPs, whilst they won't be completely eradicated. The EHCPs will be reserved for those higher needs, higher complex needs as well. And then there'll be a multi-tiered support model within schools, investment in inclusive mainstream education, and investment in workforce development as well.
Thank you very much, Florence. Lots of information there and lots of things to look up if you want to know more about that. We're moving into now what the different types of abuse are. And then we're going into what that would look like for disabled children as well, and then what to do around disclosures and reporting. But what are the different types of abuse? So we have sexual abuse. So when an adult engages a child in sexual activities, or when a child enacts sexually harmful acts to another child. We also have physical abuse. So this could include hitting, smacking, pushing, shaking, spitting, pinching, scalding, inappropriate restraints, or other ways of causing physical harm. We have emotional abuse. So this may include constant criticism, threats, or rejection, as well as withholding love, support, or guidance. And neglect. So this can include neglecting a child's physical needs, educational needs, emotional needs, and medical needs. It's a broad category and probably the most common form of child abuse. Online harms as well, which obviously is getting bigger at the moment. So online harm refers to negative, abusive, or illegal behaviour and content occurring online that causes physical, psychological, or emotional distress to individuals. It includes cyberbullying, hate speech, sexual exploitation, and harmful content promoting self-harm, often facilitated by social media and gaming platforms. And obviously that's probably going to be updated over the next year or so with the new social media ban that's come in too. And that's probably a conversation for outside of here as to what people are thinking about that. But obviously they're the kind of main forms of abuse, and there could be one or more of those happening all at one time. So they're the things that we need to be looking out for. Now, something that's really important that we don't forget or dismiss is the abuse of disabled children. Sometimes I've seen in people's safeguarding policies, for instance, that people don't talk about this abuse of disabled children. And it might be that your service doesn't really work with disabled children, but disabilities can be unseen too, obviously. And it's really important that our policies do include information there for our staff and our workforce around the abuse of disabled children, because they're especially vulnerable to abuse for a number of different reasons. So just to go through this on the slide here. So many disabled children are an increased likelihood of being socially isolated with fewer outside contacts than non-disabled children. So that also might be if a service runs a helpline, for instance, it might be that you have a disabled child that contacts that, and then it's very difficult to see what their life actually looks like. So it's good to just have it at the front of our minds as to what might be going on for that child at home or out in the community. Their dependency on parents and carers for practical assistance in daily living, including intimate personal care, increases their risk of exposure to abusive behaviour. They have an impaired capacity to resist or avoid abuse. They may have speech, language, and communication needs, which may make it difficult to tell others when offending is happening, which is always really difficult to navigate. They often do not have access to someone they can trust to disclose that they have been abused, and they are especially vulnerable to bullying and intimidation. So looked after disabled children are not only vulnerable to the same factors that exist for all children living away from home, but are particularly susceptible to possible abuse because of their additional dependency on residential and hospital staff for day-to-day physical care needs. And I'm not sure exactly how many of you will work in kind of different settings, in and out in the community, or maybe go in to support people that are in hospitals. But again, it's just a part of our policy and our knowledge that we need to make sure that we are giving to all of our staff. So we have indicators of possible abuse or neglect. And I won't go through maybe all of these because you can see them there on the screen. But when undertaking an assessment and considering whether significant harm might be indicated, professionals should always take into account the nature of the child's disability. So obviously some of these here are indicators of abuse and neglect. So just take a moment to have a look through some of that. And obviously this list is extensive and can go on and on. So it's really important to look at that individual that you're supporting and make sure that we find as much information about that young person and their disability, because it might not be that obvious. And it's always good to have that professional curiosity and ask those questions if we're unsure about anything or if something doesn't feel right. So what does this mean for practice? So disabled children are subject to the same procedures for initiating a strategy discussion, so just that initial discussion with your line manager or your designated safeguarding lead, as non-disabled children. So where there are concerns about a child with disabilities, a referral should be made in accordance with the referrals procedure. And as I said, if you have any concerns or just a bad feeling about something, always raise it with your designated safeguarding lead. And here at the OPCC, we deliver safeguarding to all of our different teams here. And we have got the saying of, if in doubt, speak out, because it's not your responsibility alone or your workforce's responsibility to take all that on themselves. So we're always encouraging the culture change here, because safeguarding is always about culture, to make sure that we're speaking about this as much as we can, so people feel supported to bring those conversations to you as a manager or a safeguarding lead. So what to do if a safeguarding concern arises? Now, again, there'll be many of you on here that are have lots of experience in this, but this training is also there for people who may be a smaller organisation that are just starting, that might not have that much experience. So please do bear with us if this is something that you do as part of your day-to-day role. So if we're needing to react to a safeguarding concern, we do need to talk to the child to get facts about the disclosure, and more to come on the do's and don'ts shortly. But the first step is always to speak to the child and tell the child and the young person what the next steps are going to be. So be really, really transparent with what is going to happen to keep them emotionally secure. So raise this with your designated safeguarding lead. Decide if you think a safeguarding referral needs to be made to Children's Services or the LADO, and that's the local authority designated officer, if an allegation is against a professional as well. And that's something to really, really bear in mind throughout all this too, because it might not always be specifically about a young person or a child that you're working with. It might be about another professional, either from your organisation or from another organisation that you have concerns about. And that's something really that we can't be ignoring. If you're unsure about whether a threshold has been made for a referral, you can have a conversation with a MASH decision maker or the LADO officer too. So again, even as a designated safeguarding lead, if there's any uncertainty, then please do call up MASH and make sure that you have that conversation to get further information. And MASH is the multi-agency safeguarding hub, just for those of you that may be wondering what the acronym is. So include all safeguarding referrals in your quarterly reporting. So as a service that may be having funding from the Office of the Police and Crime Commissioner, looking through the requirements for your quarterly reporting, you will need to make sure that you are letting us know when you have made any referrals, and also especially notifying us of any critical incidents. So that isn't just in your quarterly reporting, that is as it happens. I think on the contract, it might be within 24 hours. So if you have any critical incidents, then you must contact us. And if there is anything of any significance that you feel you do need to let us know, then again, the commissioning team, Pippa, is really open to having that conversation. Nothing's going to happen by telling us more information, but please do make sure that none of that information is not in your reporting or told to us when it needs to be. So moving on to responding and how we respond to a child when they have made that that disclosure to us. And I've realised I might do this a lot. Florence was going to be doing this and I've gone straight into it. I do apologise, Florence. But there are things to do and there are definitely things not to do. So this does look quite black and white, but just to make it really clear about helping people being able to respond in the best way possible. And there is lots more information out there online and with the HIPS Children's Safeguarding website as well. There's lots of useful information on there too, and I think that we do send links to some of their training that's provided, but there is lots out there. But there are some do's and there are some don'ts.
Amazing. I'll start with some do's. So if a young person has disclosures to you or is beginning that conversation, do listen and take it seriously. Do reassure the young person appropriately, show compassion and stay calm and go at the young person's pace. Let them lead. And do explain what will happen next in terms of reporting. You'll see the don't of confidentiality, but make sure they understand what the next steps are and about holding and containing that emotional space. But there are also some don'ts as well, which Liz will go through.
So obviously at the top there, we've got don't ask questions. Now, that's not that you stay absolutely silent. You can ask them light questions and check in with them of what they're saying to make sure that you've heard correctly. But in terms of asking it more intrusive questions about anything isn't the best way to go about things. We don't make judgments. And trying not to appear shocked or angry or panicked, which can be quite difficult, but that's really important to make sure that we stay as calm as possible. Don't rush or stop the child if they're talking openly. It might be the first time that they have been brave enough to speak out about this, so it's really important that you hold that space for them. And not to promise confidentiality. We were speaking about this when we were talking about this training, about making sure that whenever we're working with a child, that we are ensuring that we have that conversation about confidentiality right at the beginning of that work that you're going to be doing with them and supporting them with, so they are aware what will happen if they do disclose something. And it's really, really important that we keep that confidentiality conversation going when there is disclosure made, because there are things that we absolutely can't keep to ourselves, and we do have to report to make sure that they are kept safe, and not to make any promises about what is going to happen next, because it's not up to you about exactly what is going to happen, and you do need further support and guidance. So again, please do look more into that if you need to. There is training available on the HIPS Safeguarding Partnership website, free to all professionals and volunteers across the county, and we can make sure that you have that link after this training.
Brilliant. We're going to move into 3 quick fire questions just to touch base on learning. I am mindful of time as well, so please do stay on if you can. I know this was due to be half an hour, but we will have roughly around 10-15 minutes for the safeguarding adults if you can hold on. So the first question, and please pop into the chat your answer. So our first question is, what is the primary purpose of safeguarding in a children's setting? Is it A, to monitor staff performance, B, to protect children from harm, abuse and neglect? Is it C, to ensure children complete their homework, or D, to manage school budgets? And we're seeing a lot of Bs, which is brilliant, because that is correct. Thank you. We've then got question 2, which is, what is the correct action if you have a safeguarding concern? Is it A, wait to see if the situation improves, B, report it to the DSL as soon as possible, C, discuss it with other staff to get opinions, D, investigate the concern yourself? And we got another B for brilliant, because that is correct. And then,
so we've got some learning into practice. So who is responsible for safeguarding children? Is it A, only the designated safeguarding lead? Is it B, the OPCC? Is it C, every adult working with or around children? D, only social workers? E, the police? you know your stuff here, don't you? And again, it might be just as this is a refresh, but again, this is as part of the funding network, something for everyone. So those that may not know lots about this already. But safeguarding adults. So I'm going to pass on to Florence, but again, some of these organizations might be, your service might be more focused on children, and safeguarding adults hopefully might be of interest to you, because as Florence said, if you're working with a young person, you are going to know and hear about stuff about the parents or carers or the adults that support them or should be caring for them. And vice versa, if you're an organisation that is supporting adults, we need to make sure that you're aware of the safeguarding children too. So there definitely is that crossover. We will whiz through these a little bit because we do appreciate that we are nearly finished, but hopefully we won't be here for too much longer.
Just for that time check for people on, we have roughly about 6 slides. We will get Pippa to send out these slides to those of you who have attended today, and that will have information in the notes as well. So if we are moving a bit too fast, you can check in about that. But we start again with what is safeguarding adults, and then moving into that key legislation. So at its heart, safeguarding is about protecting an adult's life, protecting an adult's right to live in safety, free from abuse and neglect. So under the Care Act 2014, an adult at risk or a vulnerable adult is anyone aged 18 or over who has care and support needs and may be unable to protect themselves. And abuse can take many forms. Again, this can be physical, emotional. It could also be financial, sexual. It can also be neglect, organizational abuse. It can be discriminatory abuse, domestic abuse, and modern slavery. And under the Care Act, there are 6 principles that guide all safeguarding works with adults. And this is empowerment, so supporting people to make their own decisions, prevention, acting early to stop harm, proportionality, so ensuring we are responding in a way that is appropriate and least intrusive, protection, which is about supporting those most in need. Partnership, again, a lovely theme throughout safeguarding, is about working together and working with other agencies. And accountability is about being open and transparent. And these principles help us approach safeguarding in a respectful and person-centered way. And then you'll see on the very right of the screen some other vulnerabilities that come under adult safeguarding that you might be interested in learning a little bit more about. And again, on this screen, we just have some of the key legislation that guides safeguarding adults practice. And again, safeguarding isn't just good practice, it is grounded in law. So we've got the Care Act, which I spoke about earlier, and that is the main piece of legislation, and it places the duties on local authorities and sets expectations for all organisations working with adults at risk. We have the Mental Capacity Act from 2005, and this one is also a key piece of legislation. It reminds us to always presume capacity unless proven otherwise, and also to support people to make their own decisions. And if someone does lack that capacity, decisions must be made in their best interests, and often requires that referral to adult social care. We've also got the Human Rights Act, and this also does apply to children and young people as well. And this is from 1998, and it underpins safeguarding. So rights like the right to life, freedom from degrading treatment, and respect for a private life. We have the Domestic Abuse Act from 2021, which broadened the definition of domestic abuse and recognised coercive control and economic abuse, which are particularly relevant for adults with care and support needs. And then finally, the Charity Commission expects all charities to have robust safeguarding arrangements, and trustees are legally responsible for ensuring people are safe, and serious incidents must be reported.
Okay, thank you. So recognising abuse and responding to concerns. So staff and volunteers must know what to look for and how to act. So some possible indicators here are behavioural, physical, financial, environmental, and barriers to disclosure as well. So as an adult, there's that fear, shame, dependency. There might be communication needs or a history of trauma. And how we respond to an adult is exactly the same as how we do respond to a child as well. And it's just really important to have, again, with adults and children, that culture of open conversation and support around safeguarding. And adults may not disclose abuse for many different reasons, especially the fear of consequences, the loyalty to an abuser. And that's why our response really matters, just to make sure that we are keeping them psychologically safe while they're making that disclosure to us. And remember that our role isn't to investigate, it's simply to notice, to respond sensitively, and to pass that concern on. So, trauma-informed approaches in safeguarding. Again, there might be different levels of expertise and knowledge around trauma here, but many adults who need safeguarding support have experienced trauma, and sometimes recently or sometimes in their childhood. So trauma affects how people communicate, how they feel safe, and how much they trust services. And there might be some services here today where an adult may find that you are the only service, or that professional that they're working, that volunteer that they're working with, is the only one that they're able to speak to. So it's really important that we make sure that all our workforce have this knowledge around what they'll be doing and how to make those reports. So a trauma-informed approach helps us avoid unintentionally causing further harm. It's based on the 5 principles, sort of safety, trustworthiness, choice, collaboration, empowerment. And how does that apply in safeguarding conversations? So it's using non-judgmental language, give control where possible, be aware of their triggers, avoid that re-traumatization, and respect cultural and identity-based experiences of trauma. And it obviously builds trust, improves engagement, and supports better outcomes for them too. And it's all about getting to know that that client that you're working with, that person that you're supporting, and knowing a bit about what their needs are. So your roles and responsibilities about reporting. So your organisation's responsibilities as part of this funding network is that you have a clear safeguarding policy, that you have a named safeguarding lead, that you engage in safer recruitment. You have training and supervision where safeguarding questions are asked. And if someone is working with a vulnerable child or adult, that a safeguarding question is asked in regular supervision, as well as quarterly supervisions and an end of year check to make sure obviously their training is up to date as well. And reporting to local authority or the charity commission when required. So staff and volunteer responsibilities is they must know their policy, and that must be kept updated and sent out and made sure it's part of a staff member's induction process. That they must report concerns immediately, that they must maintain those professional boundaries and keep accurate records. So when do you need to escalate? So if an immediate danger, emergency services always. If suspected abuse, it has to go to the safeguarding lead, and patterns of low-level concerns as well are really important to record and share. So there may not be a disclosure, but it might be a pattern of information that you've heard or something that you've seen, and that also does need to be reported. Not to us initially, but if that goes on to a referral being made to children's services or adult services, then we need to know about that in your quarterly reporting. So there's some information there, the local safeguarding adults boards, so they are multi-agency coordination and learning from safeguarding adult reviews as well. And again, there's lots of information online if you want to know more about that. And most importantly, our biggest message from today, and we are finished in a second, is don't stay silent, so speak up. And I've spoken about it a lot, but safeguarding is culture of your organisation. It's culture of how you look after your staff and how you make sure that they have appropriate supervision and that things can be brought up and people won't be scared to speak. If you're unsure about anything, then please do contact the MASH or the LADU for a conversation, and they are there to help you figure it out. And there is definitely more training available through the HIP Safeguarding Children's Partnership if there is things that you're more interested in. But thank you so much for listening to us today. Again, There will be lots of you that know about this a lot, but there may be some where this is all very new, and you want to learn more. So if there are any more learning needs, and you can speak to Pippa, and we can always signpost you to more information.